Thank you so much, Hillary. Shade's got a new friend here in studio today. You know, he's been off the job for a while as dog greeter, but sorry that you're going to have a friend with you this older. He loves you, by the way. But kids are going back to school. It's important for parents to take the steps to make sure that their kids stay safe. Dr. Robert Hopkins from UAMS is here this morning. Once of all, thanks for being here this morning. Obviously, the big talker is parents at home. They love their babies. They love their kids, and they want to make sure if they do go back to in-person learning, will their kids be safe? Tell us about the precautions that they can take.
Well, I think the most important thing we have to do right now is to have those kids go in wearing a mask.
Yep.
And they need to make sure they wear that mask correctly. It needs to cover from the bridge of the nose to the bottom of the chin. You want to have them in a mask that's comfortable for them. You don't want them having to fidget with it and mess with it all the time. We need to wash their hands real well before they go to school.
Yes.
They need to carry that hand sanitizer with them so they can sanitize their hands and wash their hands repeatedly during the day.
Yep.
They need to try to make sure that they maintain their space with other kids. That's probably the hardest part, particularly for our elementary and junior high age kids. You know, think about all those kids clustering together.
Oh, yeah.
Trying to maintain that space is important.
Absolutely.
And then certainly while we want all of the older kids and the adults to be vaccinated, that's probably the biggest layer of protection we can have there. That's not something as a parent that we can control.
Right.
You know, we need to talk to the school administrators and make sure that that's on their radar screen also. But we need to focus on our kids.
Yeah, education, I would say, is the biggest point. And I would say one of the biggest talks, which you hear from a lot of people, are saying the kids who are old enough to get the vaccine, the parents are saying, well, my kid's vaccinated. What's the point of getting the vaccine if you have to wear the mask? Well, things have changed, things have developed. You know, talk about Delta. Well,
the Delta variant that we have floating around now is much more infectious than the traditional coronavirus we've been talking about. The Delta virus can put a large load of virus, if you're infected, in your nose and throat, which means you can spread it. And so even though you've been vaccinated, you can still potentially spread the Delta variant if you have it. And so we want to maintain those masks, whether you're vaccinated or not, when you're in an indoor space around other people. Try to maintain that space to minimize the likelihood of passing the infection.
Yeah, I guess one thing that's almost impossible is, you know, I think as safe as people try to be, there may be an incident. Something may happen that may be out of people's control. Yeah, what would you say for, you know, the school districts and the staff or even the parents? What is that first sign of saying, I may need to make sure my kid stays at home and maybe need to contact other people to let them know this is what we're dealing with? What's that first initial sign?
Well, the first thing we need to be looking out for is any signs of a respiratory illness. You know, does your child have stuffy nose? Do they have a cough? Do they have fever? If you hear any of those signs and symptoms, whoa, keep them home. Don't send them to school. Let's make sure that if we're having those symptoms, particularly if there's any concern about a contact, that we get them tested. And until you get the results of that test, you got to keep them home. You don't want to take a chance on giving something to someone else when we can protect them.
I would say that's huge. I know some friends personally, you know, if they hear about if they have a cough or a sneeze, they're just, don't tell anybody, because we don't want people to think poorly of us. You know, step up, be vocal, you know, potentially save a life in the process of doing so. Thanks so much. Is there a website people can go to learn more information about all this?
You can go to UAMS, but you know, also talk to your doctors.
Yes.
You know, talk to your family members that are in healthcare. We're all there to help you.
Awesome. Thanks so much for being here. Once again, Shade loves you. Feel free to take him here with you as well. All right, you can play with him all morning long.